Mandera is not new to us. We have been here about 4 times previously as we continue to spread the love and the message of Laparoscopy Mashinani programs where our aim is to change and touch lives.
We're in Mandera. We have finished our first surgery. We will be here for 3 days. We're here on a 3-day workshop. Today we saw about 30 patients, and we have more lined up for tomorrow. We are booked for 6 surgeries on our first day. Tomorrow we might have a little bit more than that. Let's see what we'll be able to accomplish in the next 3 days. This is usually very, very busy back-to-back camp and camp workshop, and we're always very delighted to be in Mandera. Our reason being here is we are running a gynecological workshop, and this time we have seen about 170 patients, and I think by the end of this workshop we'll have performed about 40 surgeries in about 4 days. I think that is quite excellent.
Straight from Nairobi, we checked in directly to Shamal Hospital, where a patient had been booked either for surgery or consultation, and going by numbers, the work is just immense. In theatre, we were able to handle 6 surgeries on the first day, which cases range from laparoscopic myomectomy, laparoscopic hysterectomy, diagnostic hysteroscopy, and laparoscopy.
You're able to visualize the opening of the fallopian tube, what we call the ostia, and from just maybe less than a minute and a half, we are able to make a diagnosis, or we're able to tell that the uterine cavity is normal, and reason for less bleeding or reduced menstrual bleeding has nothing to do with a fission inside the uterus. So the next thing we'll do, we're going up, we'll see the uterus on the outside, and we're going to check on or examine if the tube are patent.
We also managed to do some review of previous cases that we had handled last year, and the feedback was quite positive.
So this is just a review on a case that we had last year when I came here for a workshop. This was a case of endometriosis. The patient had presented with a history of severe dysmenorrhea. She had endometriosis stage 2, and we did nodular resection, and she just came back for review now, and of importance is that she reports quite great improvement in her symptoms. This is just to echo out that endometriosis is very common, and as we always insist, the treatment of endometriosis is resection of the nodule. So anytime I have success in endometriosis, is something that really I'm very delighted about. So coming back a few months after the surgery and having had good results, it's quite impressive. That's why I can never stop coming back out here. So this is quite an interesting case here, and it's common to find patients who will come with certain belief that there's an extra uterine pregnancy, and the patient here had a history of 2 pregnancy losses, and she had been seen by community birth attendants who made her believe that the placenta had possibly attached somewhere inside the abdominal cavity, and the patient actually believes that there's certain movement that she's experiencing in the abdominal cavity. It's usually a belief or psychological conception that there could be such a phenomenon, or what you would call a pseudo pregnancy. This is a pregnancy that patients tend to believe it's existing, and actually it's usually a myth. So today is our second day in Mandera, and we are headed to the hospital. Let's just see and let's go and see what we have today. So again, as you can tell, it looks a very busy day today. I've been told that we have about 80 patients that we need to see, and we might have a few procedures during the day, maybe about 10 or thereabouts. So you can see it's really a busy day for all of us, but we're excited to be here. Mambo. Interestingly enough, here for treatment, the patient would really need to consult. Family consultation is very important in the treatment decision. So even for a patient who has a severe disease like endometriosis or a condition that would definitely require surgical operation, they will definitely need to consult with family members. Then when they give an okay or they consent to the procedure, then that's when the family members will proceed and have the surgery done. Of course, there are those that will make the decision, especially if they are accompanied by their parents or certain guardian who can make decisions for their health. So we find that also being a challenge, whereby the consent decision for treatment has to be a long process of consultation. It's a good thing in a way that family and relatives are involved in the decision making should anything happen, and I find it quite interesting. But on the other side, we find that it really sometimes it might delay treatment. For example, if we leave now, we'll be back here again, maybe say in the next 2 or 3 months, and you can imagine a patient who has severe endometriosis, severe dysmenorrhea, having to wait for another 3 months for possible treatment. It could be a lost opportunity, and whereby you have disease progression occurring during that period. So all these factors is quite interesting, and you really get to appreciate different communities and their approach to healthcare uptake.
Habari mama? Uko salama? Unaendelea vizuri? We have found out that the commonest cases that we see, will be infertility, and I know that is something that is very important, not only in this community, but even the communities where we come from, the community that we are, we are offering our services to. This is, I think, it just cuts across. What would be your opinion in terms of healthcare uptake in people from this community? Because one thing I should say, for sure, I have really admired about people from this region, Mandera region, is that most women are accompanied
by their husband, which is something that we almost never see back at home. You'll have 1 or 2 patients who are going to be accompanied by their husband. Is it a culture? Is it a religion? Is it something that is just for the people of this region? That the health-seeking behavior, it's quite commendable. Is it just in the city, or is something that would span around the city? People from the rural communities.
I think, as you know, Somali culture, we really value children, and
Right.
and children are among prestigious things that somebody can boost off. We believe on the most valuable thing you can have in this leave behind these children, and so we usually having more kids, children, and is something that is supported by both gender, especially the male gender. That's why you find the male from this community are really supportive in such a text, like when we have this gynecological issues
Right.
with our sisters.
Right.
The late Mother Teresa once said, "A life not lived for others is not alive." And it's fulfilling to note and hear that our trips to Mandera for these camps have not been in vain. And these positive results and feedback is a fuel that keeps us from coming back again and again.
So here we are with Dr. Njagi. This is a Laparoscopic Mashinani. This is the 4th time they are in Mandera. Actually, Mandera had the highest maternal mortality rate in 2013 before devolution. That was even more, which is higher than even Afghanistan and even Syria and Somalia. So Njagi, when he arrived, he has met a lot of patients, ranging from fistulas, other gynecological problems, fibroids, all sorts of gynecological issues. Luckily, he came with his team, with amplifiers and laparoscopic equipment. They managed to operate close to 43 patients in every camp. And we hope to expand this program across the globe, across the country, at least the region, Northeastern Province, including Wajir and Garissa, and also maybe stretching to the Upper Eastern, also Moyale and Marsabit areas. So if such foundations can be initiated by individual surgeons, that is Dr. Ali, the general surgeon in Shamal Hospital, and Dr. Njagi, the Laparoscopic Mashinani CEO. So I'm pleased to work with them. We have successful surgeries so far. So so far we are now beginning our 17th surgery. Right now we are just in preparations. Thank you so much.
My name is Shamsa Musa Sheikh. I live in Mandera. I've been having this pain for like 15 years, but then I heard about this doctor, alhamdulillah, and went for the treatment, and I'm okay now.
Dr. Karan Maglan umaaday hadana alhamdulillah wa roon.
My name is Abdul Wahab. It was a privilege and unforgettable experience to meet this wonderful guy, this doctor. We help a lot of people here in Mandera. We appreciate a lot for his tireless work. Thank you very much.